everybody.
I'm Dr. Demaray.
I am CMT Reece, and today we're going to be talking about the subscapularis muscle.
Right. The whole month of June is our shoulder month. And so we're going to be talking about the shoulder, all the pains that it has, how to fix it, and what we can do to help you.
Absolutely.
So the subscapularis muscle, I'm going to show you a little model. This is the scapula. The scapula is the wing bone, and that it fits right here. And this is the clavicle or your collarbone, and that's also part of the shoulder. So if I were to take this off, then the part that touches the rib cage is the subscapularis muscle. And Reese, what does that muscle do?
So the subscapularis is one of the four muscles that makes up the rotator cuff in our shoulder girdle. Our shoulder is so super flexible. It's the most flexible joint that we have on our bodies. So we got four muscles that are pulling it in different directions, and the subscapularis is one of the bigger ones, and it's responsible for the internal rotation of the humeral head or the upper arm bone. So it helps you do this movement here, it helps you do this movement here, it helps you paddle, you know, it helps you raise the roof, you know, it helps you hug yourself, and it helps you say, hey, how's it going, everybody?
Right, but it can be exquisitely sore. And so when it gets sore, you can feel pain on the outside of the shoulder right here, but you can feel it as far away as the wrist. That's called the referral pattern of pain from trigger points.
That's true.
And so when a muscle gets sore, it means that there's lactic acid that's stuck in the muscle. And that lactic acid is what, when Reese massages the muscle, he releases that lactic acid, and that's when it starts feeling better. But guess what? That lactic acid starts getting into the bloodstream, and we got to get rid of it. So the best thing you can do is drink water, water, water after a massage.
And then after that, a little bit of more water.
And not coffee and not Coke, because coffee is a diuretic. So that's getting rid of water. We want to keep the water. We want to help it flush the system. So Reese, what would you do to start massaging this muscle, which is a difficult muscle to get to?
It is a difficult muscle to get to because it's got that wonderful shoulder blade or scapula covering that muscle there. So that muscle would be covered like this. So the only really area that I am able to get to is by kind of extending the arm out a little bit and getting into this area right in here. So I'd be getting a little, like this would be the only area that's kind of exposed for me to get to. So what I would do is I would kind of, you know, warm up the area first to kind of loosen up the tissue, make it a little bit easier to get in there, and then I would just kind of get in there and kind of give it a little squeeze, little squeeze. Little squeeze, compressions in and out, kind of like this right here, kind of pumping that lactic acid, getting that blood to flow through there. And, you know, we'd get little trigger points or knots, as the doc was explaining earlier, and I would kind of grab that and kind of just hold on to that for a little bit. And then after a while, it'll start to melt away.
And he's not kidding about that little bit, because that can get so exquisitely tender. It's like a knife in there.
Yes, it's very electric.
And you can touch it on yourself sometimes. It's like, oh my God. But, you know, when we have a little bit more time, like Reese does, he spends a good amount of time on the shoulder, we can really relax it. Then after he does the massage, then what we do is we put you into the adjustment room and we start adjusting the shoulder. So this scapula doesn't really have much bony joints to it, but it does lay on the rib cage. So what I do is I move that scapula around, and then I also adjust the humeral head to make sure that head is moving well. And like Bree said, 180 degrees our shoulders move. They move a lot, and the freedom of motion is important. So when we lose that freedom, we can't do a lot of things, like he said, swimming, raising the roof, and so forth. The other thing that chiropractic looks to is the neck, because the neck is where the nerves come out and they innervate the shoulder. So if the neck isn't moving right, or it's subluxation, then it's not getting the correct amount of nerve flow and the body just does not move correctly. So I adjust the neck, the middle part of the back, the thoracic spine, the shoulder, and then I'm also moving the scapula.
Absolutely.
What else, Reese? What else can we do for this?
Well, should that muscle get tight and you're at home and you're like, oh my goodness, what's going on with my shoulder? I think it's my subscap. Well, what you could do is you could look around your home for any tall, slender item, like a broom handle, or a wooden dowel such as this. Now what you want, pardon me, Doc?
Yes.
What you would want to do is you'd want to take it right in front of you, and let's say that it's my right subscap that's giving me some issues, or I think it's my right subscap, so I'll give it a stretch anyway. So I'll take my hand, my right hand, put it near the bottom of the stick, as such, and then I would just lay it down on my shoulder, and then I would raise my arm, dropping the other end, taking my other hand and gripping that stick there, and then just raising my lower hand to give that subscap a stretch. That's what you're feeling right there. You don't want to go any further than you can. All right, you don't need to push yourself that hard. So you just keep going, and then eventually it'll start to loosen up, and you'll end up a lot further than you thought you could go.
Feels good.
I might go swimming right now.
Yeah. So come and see us. We really are working on shoulders this month. It's amazing how much the patients are coming in with shoulder pain this month already.
Shoulders this month. Yeah.
So come on in, come and see Reece. He's going to give you a wonderful hour-long massage, and then you come in for an adjustment afterwards, and we will help you with that shoulder pain so you can do and be the hero in your life.
See you guys soon. Bye-bye.
Bye.